we live?
I think we're live.
Hello.
Okay. Hey guys, sorry about that. We had a little bit, some complications logistically with our camera, so I hope that we are okay now. I am going to give it just a second so we can make sure that we share on a couple of pages real quick. And I'm trying to get my Facebook to pull up also. There it goes. Okay. Nope, sorry. Okay, so my name is Jamie Cook. I'm with Breast Implant Victim Advocacy, and I'm here today with Dr. Jennifer Kessmann. We are in Dallas, and I'm just going to start with kind of interviewing Dr. Kessmann with some really basic questions, and if you have questions for her below, if you will just comment, then I will ask her those as we go along. So first of all, can you tell our viewers a little bit about yourself?
Sure. My name is Dr. Jennifer Kessmann, and I am a board-certified family medicine physician. And I've been practicing since 1996, actually, so been around for a while. And I got involved in integrative and functional medicine around 2008. And certified in functional medicine in 2018. So I've been doing it for a while, but yeah, I can kind of cover all of my bases with all of the different things I do. But I'm so happy to be here with Jamie. She's been a really good friend of mine for the last 5 years, and I have learned so much from her, not only, you know, in regards to breast implant illness, but also just how to navigate, you know, a system that is sometimes very challenging, I think, as all of the people on Viva know. So thank you, Jamie, for having me, and thank you for the work that you do.
You're very welcome. I likewise have learned an immense amount of information from Dr. Kessmann. Hi, we've got Danielle on. Of course, we know Danielle's been doing some lives also, so welcome everybody.
Hey, Danielle.
What is functional medicine? So if somebody were to come to you and say exactly what do you do, can you describe that to someone?
Well, my original background was nutrition, so I came to medicine through a nutrition pathway, which sort of gave me a different perspective, you know, throughout medical school. And I just kept seeing patterns in my patients, and I wanted to do more of that and understand more of the biochemical aspects of nutrition. And so functional medicine was a perfect fit for that. Mm-hmm. And through that process, I had, you know, through family and personal experiences with immune system issues, it really helped. You know, I saw how transformative it can be in some people, and then I was sold. And once I learned more about it, you know, it's hard to go back and unlearn it. But functional medicine is a way to look at things from a different perspective, you know, because a lot of these things we weren't born with.
Right.
And so something happened. What happened that changed mainly our immune system and changed our internal environment that caused our symptoms to occur. So.
When you first started into the medical field, is this where you thought you'd end up?
Oh, absolutely not. I don't think it existed. Functional medicine existed then, but I, you know, went to medical school, and you know, we had a 1-hour lecture on nutrition, and I kind of learned that it wasn't important back then. Now I think that's different. I think the platform is much different, but at that time I was sort of, you know, the oddball to believe that, you know, that nutrition was important to health, and that's changed a lot for sure.
Yeah, I definitely think there's been, you know, a bit of a shift from Western medicine. Hopefully we'll continue to see more doors open up with that. Currently, so you practice in Dallas. Do you currently see patients who exhibit symptoms of breast implant illness?
Right, so it's been an interesting process because a lot of the patients that we see in functional medicine are coming to us because they have an immune system that's over-functioning and making them feel sick. And they don't know what's causing it, and they want to feel better. They're just desperate to find something that will help them. And they've been to usually a lot of different doctors, a lot of different specialists, and then they end up here. And sometimes nobody has mentioned that their implants may be causing their immune system to become dysfunctional, I guess is the best word to say. And so, when I see breast implant illness and, 30 symptoms, that they have, when I see breast implants on their intake forms, I'm always, I have to wonder, is that one of the possible root causes of their immune system dysfunction? So
is
there's
that
a lot of work.
a hard subject to bring up to a patient who perhaps doesn't know about breast implant illness?
Absolutely, it is, because it's just now getting around from people like you and from all of the women that are out there. It's just now becoming knowledge in the medical environment that implants can cause an issue. And I think a lot of that may have been brought about by the ALCL, the lymphoma,
right,
that is an immune system cancer caused, hands down, from breast implants. Certainly, we'd like to see, who is more at risk for that. Is there a certain predisposition that patients carry that makes them more at risk? And most of the studies have been done in other countries. And so, it's sort of like you have to be a detective and find it out, search it out on your own. It's not something that's being taught in the medical environment. So what's difficult and challenging is, I always want to make the patient aware of it, but I can never be sure that implant removal will improve their symptoms.
Right.
We can never be sure. We don't know. And that's where I think more research needs to be undertaken to identify who is going to benefit, from implant removal, who's not, and then also who is going to perhaps be at risk, because there may be genetic predispositions or even symptoms that you had prior to your implants that maybe you were more allergic to things, and generally your immune system was less tolerant than other people who have no problems with their implants.
Right.
So.
Yeah, and I definitely think that's a very, very difficult question to answer right now, because we don't really know. We don't know why I'm sick, but my neighbor may not be sick from her implants. And I think up until the last couple of years, it's really just been the medical community saying it's not a possibility, it's not a possibility. So I do think over the last 2 years we have seen a shift in that, and it's gone from no, it's not your implants to maybe it's a possibility that it's your implants, and then even more we've seen some doctors fully shift to say yes, it's highly likely that it's your implant. So
right, and I think that as that environment changes and more plastic surgeons are aware of it, and they're able to give consent, informed consent to their patients before implanting through the new FDA guidelines, I think that the environment will change dramatically, and we will have to start addressing these issues. Who's at risk, who really has implant illness, and who may have, for instance, mold or Lyme or a pesticide exposure. All of these things can cause immune intolerance, where the T cells just kind of overreact. So the symptoms are vast. When these people are sick, they get sick anywhere there might be T cells overreacting, and it just depends on what they're overreacting to. You have T cells in your eyes, you have T cells in your throat, you have T cells in your lungs, in your gut, and the majority live in the gut. And so, we can do some work to help calm that dysfunction, to see if it will help, through gut modulation and dysbiosis, correcting dysbiosis. But the other problem that I find with that is that if the implant is causing the immune dysregulation that's causing all of this immune dysfunction, that you're allowing it to sort of fester, and you're not providing the best opportunity for improvement, and it really, I think the way that you said it one time when we were having a conversation, and that's really right now a personal decision on whether you have your implants removed when you're sick.
Right.
And people are either sick enough or they're not, to make that drastic
I definitely think
choice.
when you get sick enough, you're willing to risk whatever your aesthetic appearance. I know in my situation, aesthetics no longer mattered. It was I've tried everything else there is. This has to help me, and I think we see that in a lot of the women. So do you feel like, I mean, and we do see a lot of Lyme patients, we see a lot of women who are exposed to mold. Is this a synergistic effect, do you believe? I know we had some people at our conference in Dallas a couple years ago, and Dr. Cowden, he kind of explained it as you have this wagon, and you have this toxicity, and this toxicity, and this toxicity, and they come in like boulders into your wagon, and all of a sudden it's overflowing. And
Right.
so what do you remove these things one at a time to kind of see what it is that's going to reduce those effects?
Yeah, that is what I generally do in functional medicine, but that concept is, I believe it's from environmental medicine. And Dr. Ray had a barrel, and he has pictures all over his office of this barrel and everything that can cause immune dysfunction, which includes even things like stress. So a lot of times I'll see patients that get sick like 2 years after a very traumatic event, or a divorce or something, and it's not that their stress is promoting that or continuing it. What it did was it caused that immune system to react, and then that kind of, you have mediators in your environment that continue it. So if you can pull out those mediators, which are the contents in the barrel, which may be like perfume, for instance, or petroleum products, or even fabric softener, these people get very sensitive when their immune system becomes intolerant, and they become allergic to everything. And I think a lot of the BII community, has a lot of food allergies, for instance, and that's one thing that I think everyone is well aware of. But I think that for a lot of these patients, they're having a lot of symptoms that are actually coming from chemicals and things in the air, or mold, or pesticides. With the eyes and the respiratory tract, the immune system is prompted to react to chemicals sometimes, and that's that Dr. Cowden and Dr. Ray pulling out what you can and allowing those T cells to calm.
So for some, they may think removing some of these environmental stimulus improves, but you get to the bottom of that and they potentially still have this underlying stimulus, which is the implant, potentially, and will removal of that stop the stimulus or not? And we don't know. I mean,
you really don't know, and I do think that there are patients that have no problems with their implants, and they may have better genetics, they may have had less exposure to petroleum and plastics throughout their lives, so their immune system is more tolerant in general. And we were talking earlier, and I think this is fascinating, and I just learned it from a Dr. Engelman the other day, and he was talking about when we're in the womb and our immune system is developing, if there are T cells that are reacting to everything, which there are, that those are removed, in gestation, during gestational time, so that we don't have autoimmunity or immune intolerance. And so, if even going back to that time, was it something even as far back as that there's a difference in how that happened, even pre-birth.
Yeah, that's it. And we talked a bit before the video about T cell activation, and it goes pretty in depth, but it is very interesting conversation. I hope maybe one day we can go a little bit more in depth on that, especially in relation to bia-alcl, which is a T cell lymphoma. Excuse me. What are the most common symptoms that you're seeing in the patients who come to you for potential breast implant illness?
Sure. So I think fatigue across the board is just probably the most common symptom, and brain fog, and memory, concentration issues. Depression, anxiety can be a part of that, but certainly there are a lot of things that can cause fatigue and depression, anxiety, and arthritis, skin rashes. But there's some things that make it more likely, like for instance, skin rashes that you see on the chest and the shoulders. To me, that's sort of the lymphatic drainage pattern from an implant. And I don't see other conditions that only have rash on the chest and shoulders and maybe under the arms. And so that makes me think more specifically that it could be the implants that are, creating an issue for the immune system. But it can be very difficult to tease it apart, and I think the more symptoms people have, the more likely it might be their implants,
Yeah.
But also, that being said, the more symptoms you have, the more likely you may not get better, because you've had this illness going along for a long time, perhaps. Although it is totally across the board. Some people get sick right away from their implants, and other people it may take 6 to 8 years, before they're
Yeah, we definitely see a wide array of symptom progression and initiation of symptoms. Do you see primarily that the patients have just the symptoms, or does it correlate with autoimmune diagnosis, connective tissue disease diagnosis?
Honestly, the patients that I see, there's a mix. There's definitely a mix. The ones that have an autoimmune diagnosis are generally, already well invested in Western medical care. They have their rheumatologists and they have their doctors that are managing that for them. When their autoimmune disease becomes out of control, that's when they come to me, because they're not getting everything they need from their physicians. So we try to work with that, and again, I may be the first person that has even suggested that, it could be, just kind of mention it. I feel like it's my duty, now that I know all of this, to mention it and let them kind of investigate and decide if this is a personal decision that they want to make.
It's a hard decision.
For a lot of women, it's, it's another surgery. I mean, it's not an easy decision to make, for sure.
Yeah.
Financially,
physically, mentally.
Yeah.
You may, for me, it was a cosmetic decision. So when I had to decide that it was time to remove my implants, I had to mentally, physically, and financially prepare for that decision. And for reconstruction patients, that's a whole other ballpark.
Absolutely.
Something that I of course will not understand. I can't put myself in their shoes, but it's definitely not an easy decision. But it would be interesting to hear, maybe from one of those patients who didn't even know about breast implant illness, what was that a trigger? Was that a light switch in their head if it was mentioned to them, hey, do you have any kind of implantable implants? And what they thought about that after the fact.
Yeah, yes, absolutely. Maybe you could do a Facebook Live.
It might be something to, it makes it personal. So Maria had skin rashes. I think skin rashes and fatigue. Somebody mentioned headaches.
Did I mention joint pain?
I don't know if you mentioned that, but that's...
And the Delphi consensus panel that we're both on are trying to kind of consolidate down, the list of symptoms to 5,
which is hard.
It is hard, which I think is a start. It's a start in the right direction. But again, the people that have more symptoms are probably more likely to be the ones that have BII. And so yeah.
We do see the commonalities. And BI it's really complex. Can you briefly explain your thoughts
Maybe.
or your theory on breast implant illness specifically?
Oh, my goodness. Yeah, so anytime there's, try to break it down a little bit, anytime there's a foreign body, you can get a reaction. And even the fact that the capsule forms around this implant means that there's a foreign body reaction, going on, and that is all carried out through the immune system. The T cells and B cells, dendritic cells, macrophages, all of these different players is sort of like a football team, and they're all playing together, and usually that process happens and the immune reaction happens, and then it shuts itself down. When you have, say, for instance, an illness that isn't better, I'll just use this example, or you have a splinter, for instance, which is a foreign body.
Mm-hmm.
And if you've ever, I think everybody's had a splinter, and sometimes, they don't get infected and they don't fester, and the skin grows over and everything's fine. Or other times they have this horrendous reaction, and until that splinter is out of the body, that reaction is ongoing, and it's just all of these chemical messengers that are bringing T cells into that local environment. They kind of call up the troops, if you will, and
which is the natural
that's
response.
natural. That's what's supposed to happen, right? And so the immune system is trying to work with you. So anytime there's an implantable device that maybe gets a bacterial growth on it, or we know that, like for instance catheters, if they get infected, you have to remove them because that the immune system has more difficulty with that implantable device. And I'm not saying breast implants, but I'm saying just a catheter, either in a central vein location or in the bladder, urinary bladder. You have to remove those things if they get infected, for sure, because it's just very difficult. That immune reaction will just keep going and going and going until you get really, really sick. And I think that COVID-19, is, if you have the consequences that are causing cytokine storm, that's exactly what I'm talking about, is cytokine storm. And that's a whole higher level, although I think that some of the people I've seen on your page qualify for cytokine storm, if you see, look how sick they are. And, they get their implants out, and I've seen them interviewed, and they are better, and they look beautiful again.
Some of it's pretty amazing.
It's pretty amazing, right? And so when you see that, it's hard to deny, that and I think the people that don't get better, maybe there are other things that need to be pulled out of the environment as well, because when you're in that kind of storm, and I think you were bringing this up earlier, you're reacting more. Your immune system is more reactive to everything. And until you remove maybe all of those potentials, which is sometimes really hard, but certainly the big ones, if you can get rid of those, then you're going to have a better chance at quieting things down. And I think working with functional medicine doctors is a good way to find those other things. So maybe they're not familiar with implant illness, because it's not really something that's really discussed openly in medical communities, which except for in that plastic surgery arena, it has not made its way down yet.
Yeah, we need it to. We need it in, rheumatology, we need it in functional medicine, we need it in, really even infectious disease, because you've got, patients with, I had EBV, we have all these things just compiling one on top of each other. And if you have the other specialties just open their ears a little bit, I think that we can open this communication and kind of talk about it a little more.
I think it'll get there for sure, yeah. And that, that EBV diagnosis, I do see that a lot. And that can be from that imbalance. When you have too much of this, the immune system is all directed in that direction, and it shifts. And so...
Yeah, people, I know, now this is just my personal opinion, but I've been asked, do you think your implants caused your autoimmune? Well, I didn't have autoimmune prior to my implants, but I always say I don't think that it caused my autoimmune. I feel like it was a trigger. So perhaps I did have that predisposition to autoimmune disease. Maybe my body could have tolerated it, and then now all of a sudden I have this trigger, then compiled everything else, Epstein-Barr and autoimmune, and in my case, the removal took away 90% of my symptoms, which we see fairly often in the women in the community. So I don't know. Sorry, I had to look at my notes here. You kind of talked about what role does functional medicine take in treating patients with immune tolerance. So do you want to expand on that? How do you start with a patient? Do you, is there, lab work involved? Do you rule things out first? And of course that depends on whether the patient's coming into you for BII or autoimmune tolerance. But if you were taking a patient with what you believe to have autoimmune intolerance, how do you start with that patient?
What we do in functional medicine across the board is we usually start with a timeline. So we get a good history, very thorough history on the patient, and look at, kind of plot out everything that's happened in their life that may have been a potential trigger. So plotting it out, usually just by the year, what happens in sequential order. And a lot of times we'll see a lot of antibiotic exposure, or maybe they grew up next to a chemical plant. Where were they born? Were they even breastfed? Or, bottle fed, how is their gut environment? How did their immune system learn, what it's doing today? So your immune system is completely different than my immune system, and everybody's immune system is very unique. So we have to, always remember that, that we're all different and our immune systems are all different. So then moving back through that timeline, and when did you feel well last? And then looking at what is surrounding that. And generally the patient is able to see, oh, wow, I got divorced, and then I, had all these infections and my sinuses, and then they're able to see, or I moved to this house that had mold in it, and didn't know that was the root cause of my problem. So it's kind of fun to look back with people, but it takes a lot of time. So, my first appointment is usually an hour and a half to 2 hours. And we just figure out what your unique symptoms are and your unique predispositions might be.
So this is definitely not a field that has an algorithm-based approach. Like you can't sit there and treat me and my neighbor. It's not going to be the same pattern. It's not going to be the same diagnostic approach.
I think that individual physicians probably treat things differently, but there are some algorithms, yes, ingrained into that, but at the end of the day, across medicine, across the board, I would say, every patient is still very unique and very individual, and how they're gonna respond to even a medication or anything is going to be different. So, but functional medicine probably goes a little bit deeper into that.
Yeah, concept. I don't know that I would have thought about making a timeline of my life, and unfortunately with a lot of us, the brain fog kind of makes that a little bit difficult. I mean, by the time I explanted, it was hard for me to process any kind of thoughts. So I can see that would be a struggle when you bring a patient in and it's hard for them to even backtrack to trace.
Yes, you have to give a lot of information written, because when you're really sick like that and things aren't functioning well for your brain, it's really hard to know what to do. It's really hard to make a decision like you made, and with clarity. And so if we can bring back some clarity through modulation of the gut, for instance, then sometimes they're able to say, gosh, I think I want to do everything possible to get better, because brain fog is like so incomprehensibly awful to live with.
And it's hard to explain to anybody, I think, if you haven't
experienced it. It's becoming more common, and this is across the board in patients that don't even have implants. So it's not only implant patients that are getting a lot of brain fog. So we have another something going on.
Well, I mean, we have a lot more environmental food factors to take into consideration on that. If you have a specific question for Dr. Kessmann, if you'd like to comment below, we're probably going to wrap it up in just a couple of minutes. What improvements, in your opinion, do you think need to be made within the medical community to address concerns? I mean, like I said, 5 years ago, a lot of us as patients were completely dismissed. I think we're seeing that shift. We're not quite in all the disciplines yet, but what do you think needs to happen within the medical community? How can patients help?
Yeah.
How can patients help the medical community?
That's a great question, and there is so much that actually needs to be done, unfortunately. But I think being a little bit we need to first figure out a diagnosis and acknowledge that it exists, and acknowledge there's a problem, so that we can start objectively investigating it and looking into research on who is predisposed to it, who can benefit from different therapies, that might help. And but women being tolerant also, and understanding that this is where we are, and it's not anybody's fault, that this doctor doesn't know. Well, I don't want to say that, but there are a lot of doctors who just have not heard about this, and they want to learn. When I come in contact with someone, a physician, well, some of them. They want to learn about implants, and and especially if their wife has them, or something like that. And so I think it's just moving forward, to decide who's at risk, potentially for developing this, but knowing what the symptoms are. So if you start developing them, you may consider what your options are before you even implant. Yeah, and that's the work that you guys have done, which has been just so amazing.
Well, our community is
amazing. How
amazing.
amazing that
Our
is.
communities,
Yeah.
really come forward full circle the last probably 2 to 3 years. And I do think the discussion on bia-alcl specifically, once the medical community realized, hey, now there is a definitive link between implants and cancer, which they said forever that there was not a link, it has opened up doors to, well, if we can cause an immune system cancer, why can we sit here and say that it can't cause these other issues? So while we're not there yet, I do think we're working that way. Possible genetic testing of patients who are sick, what's the difference in my genetics versus somebody who's not sick, can potentially help. And then also, the broader spectrum, the broader umbrella of implantable devices in general, and the other patients who are exhibiting similar symptoms, and that's being investigated. So your hip patients who are potentially exhibiting symptoms, your IUD patients, your Esher, of course, we've worked well with the Esher ladies. And are these patients exhibiting similar, short list of symptoms? And if so, then that gives us an opportunity to reach more disciplines than just plastic surgery. I don't know.
Sure. Yeah, absolutely. Well, thank you guys for watching. And
do you have anything else specifically that you want to talk about? Deneen says, do you feel like genetic tests need to be done prior to finding a surgeon for explant specifically?
That's a great question. The issue is we don't really know what the genetic tests mean right now. So I don't think that, it would be great if there was someone doing a research study and, put together, genetic tests so we could start looking, with what genetics and sort of linking these things together. But right now, as far as I know there's some plastic surgeons that are doing research on their own. But I don't know that they're looking at genetics specifically.
ASERF is sponsoring a capsule study, so that's in the process. Tess Schulman, she is one of the Esher admins and admins of Medical Device Problems. So we may tag this in a comment. She's actually started a group to discuss genomics and studying. They're going to start with breast implant women. So they're looking for people who have had their genetic testing done and they're not quite there yet, but might want to pull that data from those patients. So I'll definitely add that link and tag her here. Terry said exactly, no autoimmune except for cancer is ridiculous. I agree. I don't know how a doctor can sit there and say that implants can't cause autoimmune if it's causing an immune system cancer. I don't know that we have, I may have missed some dermatologists. That's another field that we didn't dive into, but I do believe dermatology is another field that really needs to be knowledgeable on this, because skin rashes is one of the top symptoms that we see daily. It's weird. I didn't have skin rashes. I didn't have the food and chemical sensitivity. It would be interesting to see how those correlate with silicone versus saline, or one brand versus another.
Sure. That's the other thing. There's all different kinds of implants and different brands, and
I think that's what makes our situation so hard is like Esher, for example, it was one product, it was one manufacturer, and we have such a wide variety of models and manufacturers and components, upgrades in their device innovation. So we're not there, but it will be interesting to see what comes of following these patients more. It is very complicated. Does anybody have any more questions for Dr. Kessmann? I appreciate appreciate you.
Thank you.
You being my
Tuning
guinea
me.
pig today.
It's always good to see you. So I'm so happy to see you.
Biva is actually going to start trying to do live interviews a little more frequently. We feel like this kind of gives you an opportunity to interact with us and us with professionals, answer some of those questions that we all have, and it's going to take us a while to get the answers to those, but we have to start with open dialogue, especially with our clinicians. Deneen said, is there another meeting scheduled with the FDA? Not currently. I think COVID has kind of ruined opportunity for any kind of meetings in the near future. The FDA, they are still everything's kind of halted. There's so much of their staff is focused on COVID-19 right now, but we do know that they are still in discussions about the black box warning and the informed consent checklist. So even though we haven't heard about it, it is still being talked about behind the scenes, and they are still currently working on that. So I would like to give you hope that is still happening, and we fully believe they will complete that, hopefully in the near future.
On the 18th, which was just recently, they posted about the black box warning and the consent, and I hadn't seen that before, so I don't know if that was new, but I was very encouraged by that they are really, moving forward with that, which will be awesome for women.
Yeah, I mean, as most of you know, the FDA doesn't move very fast with anything that they do, but the March meeting in 2019, I think, played a really integral part in them saying, okay, we have to do something, and the consistent pressure from patients and advocates. I think they can't avoid it anymore. They can't ignore it. So it's in the process. It's just not a fast moving thing with the FDA, unfortunately.
Yeah, that's just better be careful and cautious. And
yeah, I mean, I do have to say that I was happy that they reached out and asked for guidance on their documents, and we just have to hope that when those come out, that they're going to we're going to be happy with those. Yes. In my mind, again, I agree with Dr. Kessmann, and I know that I get backlash a little bit about it, but I don't believe every woman gets sick from her implants. So my theory and my feelings are that it really comes down to having an informed patient and making sure that patient, when she makes that decision, knows the risks, and if she continues to make that decision, then we continue to follow her. And she knows what she's going into, and she knows what to look for, and that especially goes for reconstruction patients. So, yeah. Okay.
Thank y'all.
Deneen said, "Where can I find that information?" Oh, about the black box warning. Deneen, I think Terry may have commented that link for you below.
Thank you, Terry.
Terry's on it. Terry's always on it. Okay, well, thank you guys.
Thanks, bye.
Thanks, Dr. Kessmann, for meeting me. And if you have additional questions for her after you watch this video, we'll make sure that she follows. And just type your questions or comments below, and I'll make sure that she...
Oh, you're going to make sure.
That you follow that for us.
Okay, good. Yeah, your little bird.
Hey, you have a question.
Thanks,
All right,
guys. Thank you, bye.